Everybody, my name is Armando, and I'm the second affirmative speaker. So as my partner said, there are issues in the current healthcare system. As of now, there are certain flaws. According to the Public Broadcasting Service, in an article, A Healthcare Crisis, Who is at Risk? About 44 million people in this country have no health insurance, and about another 38 million have inadequate health insurance. This means that nearly 1/3 of Americans face each day without the security of knowing that if and when they need it, medical care is available to them and their families. Having no health insurance also often means that people will postpone necessary care and forego preventative care such as childhood immunization and routine checkups completely. Because the uninsured usually have no regular doctors and limited access to prescription medications, they are more likely to be hospitalized for health conditions that could have been avoided. So this kind of argues the point. For people who are suffering from heart disease and all that are uninsured, they could have gotten checked out and probably taken medications to prevent such cases. According to Sherry Glide, PhD Associate Professor of Public Health at Columbia University, people who are most at risk today are those who have no health insurance at all. They're at risk of not getting regular care when they need it. They're at risk of not catching real problems before they get serious enough to not be treatable. And they're at risk of not getting the best treatment when they actually do get sick. And they are at tremendous financial risk. They could lose everything that they saved their lives for because of some fairly minor health problem. And my partner actually mentioned how it's super expensive, especially if you don't have health care or you get an ambulance. I actually have a personal experience where I was in Glamis riding in the desert with my brother. My cousins had a side-by-side or a Razor. This is before they had doors. We're riding, going on the side of the dune, went sideways, my brother stuck out his leg, broke his tibia. So he didn't have health insurance and actually got airlifted to the hospital. Surgery was performed immediately and pretty much stayed there for about 2 weeks. So about a month later, after he got his medical bill, came out to around $75,000, and he's still paying it off today. So there's an example of medical debt and kind of the flaws of not having health insurance. So according to Marcia Angel, editor-in-chief of the New England Journal of Medicine, our life expectancy is shorter, our infant mortality is higher, our childhood immunizations rate is lower, and look how often we get to see the doctor. How long do we get to stay in the hospital? Canadians see the doctor far often more than we do. Americans really can't afford to see the doctor because there's always some sort of co-payment, deductible, or simply we have to pay out of pocket, or it's not covered by current insurance that we have now. But in Canada, where everybody is covered for everything, they go to the doctor much more often. When they are hospitalized, their hospital stays are longer. If they're having a baby, for example, they are able to stay to 4 to 5 days. Also, Japan has a very long hospital stay, almost a rest cure. People in Japan are hospitalized, might lie in the hospital for about a week or two just to take rest. So, are we really getting our money's worth? According to David Squire and Chloe Anderson from the U.S. Healthcare from Global Perspective, the United States is the highest spender in healthcare. We clearly are spending the majority of our money in healthcare. Data from the OECD, Organization for Economic Cooperation and Development, shows that the U.S. spent about 17.1% of its gross domestic product on healthcare in 2013. This is almost 50% more than the next highest spender, which is France, and almost double what the UK spent. Again, according to Marcia Angel, editor-in-chief of the New England Journal of Medicine, here's a system. She's talking about our health system. Here's a system which we spend over twice the next most expensive country spends on healthcare. That's Switzerland. We spend roughly about $4,500 on people who are insured and are not insured. Switzerland spends about $2,500 per citizen. Canada, $2,000 per citizen, and Great Britain about $1,000 per registered citizen. So what necessarily are we getting for what we pay for, that $4,500? Clearly not our money's worth because we still have people who are uninsured. Also, there are people who are underinsured. This means that they have shrinking packages or they provide coverages which is not necessarily covered. According to Dominic Caruso from the Harvard Public Health Review, in the article Single-Payer Health Reform, a Step Towards Reducing Structural Racism in Healthcare, in our view, a national single-payer health insurance program offers the best possibility for equiting financial U.S. healthcare. It would eliminate the motive to deny needed care or discriminate against the expensively ill for the sake of profit. A national public insurance system will provide coverage based on residence in the U.S., not employment status, income level, or the ability to pay, as in the current regime. A program that abolishes copayment and deductibles will level the playing field for minorities and poor who generally lack the assets to surmount these barriers. So as my partner was saying, would kind of curb poverty because it would help, again, save money. You're not necessarily paying a lot of money, so you save and you also get healthier out of it. And then lastly, providing all citizens with the right to healthcare is good for economic productivity. When people have access to healthcare, they live healthier lives. They miss less work and it allows them to contribute more to the economy. A March 2012 study by researchers of the University of Colorado in Pennsylvania showed that workers with health insurance miss an average of 4.7 fewer workdays than employees without health insurance. According to an Institute of Medical report, the U.S. economy loses about 65 to 130 billion annually as a result of diminished worker productivity. Due to poor health and premature death among the uninsured, in January 14, 2014, Speech World President Jim Young Kim stated that all nations should provide a right to health care to help foster economic growth. So this is an example of why national health care would be beneficial to kind of help economic growth.